What we need to make sure is that you're getting a couple of blood tests consistently. C-reactive protein and homocysteine are the two tests that you really have to get consistently to find out whether your inflammation markers are going up or going down. I can guarantee you, if you go the vegetarian route, your C-reactive protein, your homocysteine will go down. If you continue to do the coffee and the alcohol and the sugar, and it's going to go up. And that's just, and most disease has inflammatory complications in it. And so, and when we talked about your brother, was it, that had did he have the double bypass?
No, he has not had it yet.
Okay, so here's
He happens to be a free bleeder and didn't bother to tell the doctor that until the day of surgery.
here's an alternative. Here's an alternative. And everything that I'm telling you today is not my opinion. It's the science that I know, and I'm sharing that science with you. And what I know is there's a thing called chelation therapy, okay? Chelation therapy uses a molecule called EDTA. And EDTA takes heavy metals out of the body. Calcium has a similar molecular structure to heavy metals. And calcium is one of the things that plaque is made up of, all right? So if you take this intravenous chelation therapy, it pulls the plaque out of your arteries. We know this because there was a National Institute of Health study with 50,000 people in 10 different locations, and they found out that yes, those people all got symptom recovery and improvement after they did their chelation therapy. These are people who couldn't walk 50 feet without having to sit down. Now they can walk 500 feet, a half a mile, because we know that this works. We know why it works. We know the mechanism of action. There's also a softer form of it. There's a thing called serrapeptase. Serrapeptase is an enzyme that comes from a silkworm. And Hans Napier was a German scientist who had a bunch of people who had blocked carotid arteries, and he couldn't operate because they were already like 90% blocked. And sometimes when you try to do surgery at that point, some plaque will get loose and cause a stroke, all right? So he really was vigilant looking for alternatives, and he found out about serrapeptase because what happens when a silkworm is in the cocoon and tries to metamorphize, they release an enzyme that doesn't harm the healthy living part of the thing, but destroys the other part that needs to be taken away. Well, he then hypothesized that if this was true, maybe he could get rid of things that aren't supposed to be in the body. And so he experimented. Within 6 months, he got people who were 90% blocked, according to MRIs, down to 30 and 40 and 50% blocked. In other words, this serrapeptase was able to do this same reaming out of the arteries. So, and nattokinase is another, it's kind of a Japanese version of serrapeptase, and it comes from bacteria. But the two of them together are often used in protocols. If you Google nattokinase for heart disease or serrapeptase for heart disease, you'll find some scientific studies that will verify that this is true.